Thank you, Dr. Deepamala and Sahani sir. Good evening, good afternoon, and good morning. This is the 1910th day of continuous webinar conducted by International Forum for Promoting Homeopathy. Today, our guest is Dr. Dhanalakshmi R. Mallan. Let us begin the session with 1 minute silent prayer. Thank you all. The International Forum for Promoting Homeopathy comprises of homeopathic lovers, students, and doctors. And we have 3 sessions every day. The first session of the day is already over in Hindi from 7:30 to 8:30. And from 8:30 to 9:30, we have the international session in English. And from 9:30 to 10:30, we have a local language session in Malayalam. We are uploading the videos of the same on the very next day itself so that those who miss the session can watch it again. You can subscribe the same without paying any money. The purpose of this forum is to take homeopathy to every home around the world. And let me come to today's guest. And today's guest is Dr. Dhanalakshmi R. Mallan. She has completed BHMS and Diploma in Clinical Psychology and consultant physician at Dr. Mallan's Homeo Clinic, Cherthala, Alapi district in Kerala. And is the second generation doctor. That is Doctor. She is the daughter of Dr. A.R. Mallan, who was a retired district medical officer, Alapura. He has there to promote homeopathy from in a better way in Kerala and around the world also. He has she has worked at RVS Homeopathic Medical College, Coimbatore as lecturer and residence medical officer. She has more than 15 years of experience, and very recently she had presented a paper on breastfeeding and homeopathy here. That was an excellent session, and hope this time there will be another session that is menopause and its homeopathic management. That we are expecting a big session because it's a very, very wide subject, and homeopathy can do excellent work for management of menopausal problems. And let us see what Dr. Dhanalakshmi has to say about. You are welcome to this session, Doctor. Please unmute yourself and please unmute. I shall make you co-host now. Okay.
I'm audible, doctor?
Yes, yes, yes. Audible and
Okay. First
visible.
of all, yes, thank you. First of all, let me take this opportunity to thank the fraternity of IFPH to give me yet another opportunity for self-development and teaching. It is 1910th session today, and conducting these sessions continuously without fail, that too in 3 languages, takes a lot of dedicated efforts and conviction. I congratulate the whole fraternity on this. Coming to our topic, let me share my screen.
Yes, visible.
Okay.
Fine.
So menopause and homeopathy. Aging happens to both men and women. So why is menopause so special? Why is aging in women so special? Actually, the difference is in the rate of decline of their hormones. For men, the main hormone would be testosterone, and women, it would be estrogen. So, testosterone declines in level gradually over a long period of time, that too in a very asymptomatic or non symptomatic way. But in women, this change happens rapidly over a very short span of time, over a few years' time, and that too nothing but asymptomatic, with a lot of symptoms like hot flushes, insomnia, mental disturbances like mood swings, emotional disturbances, and a lot of symptoms. Name them, you have them. Dr. Lisa Mosconi, a neurosurgeon, conducted a research by comparing brains of premenopausal women with postmenopausal women, and that too comparing them with the men of their corresponding age. So you can see the picture here. The first picture shows premenopausal brain, which is brighter and more yellowish. And the second picture is after menopause, it is more orangish color. The researchers show that a 30% decline in brain energy level. So, although decline in estrogen happens in ovaries, the changes start happening in the brain. And also, there is a significant increase in amyloid plaques. They are hallmarks of Alzheimer's disease. And it is noticed that for every man having Alzheimer's disease, there are two women having the same disease of similar age group. So, menopause, is it something to see with sympathy, or we have to feel sorry for the whole womanhood? No. There are a lot of opportunities coming with menopause. It should be actually called menostart because it marks a start of a second adulthood. Just as a lot of hormonal change happens during puberty, during pregnancy, during every menstrual cycle, there is a lot of turbulence happening during the menopause too. But this gradually settles down, the hormonal levels come to a balance, gets regulated, and then the drastic change happens. The first thing a woman experiences would be freedom from menstruation, freedom from the everything associated with menstruation as well, like premenstrual syndrome, all those abdominal pains, back pains, cramps in the body aches, the fibroids happen to shrink after menopause, endometriosis gets reduced, and menstrual migraines get reduced, and there is no fear of pregnancy. The non-productive, they are of course non-productive, but highly productive. How does this rise in productivity happen? As I said, as the hormone levels stabilize, a lot of changes happen in a woman's body. They tend to be more happier and content. When you see a graph comparing the happiness level all through womanhood, it declines over around the age of 50, but after that, it can be seen to rise. Great psychological strength also happening. Self-realization happens. She's stronger and much capable than she has imagined herself to be. Okay, she becomes fearless. She doesn't fear to be judged. There is emotional mastery, the I don't care attitude. After all the challenges, losses, and disappointments she has faced in life, the resilience she has earned, this is the stage where she has mastered all her emotions. There is greater empathy that is noticed. So again, during the three P's of a woman's life, puberty, uh, pregnancy, and perimenopause, a lot of changes happen. During puberty, her body and mind gets ready to start a new life, to nourish a new life. Again, during pregnancy, a lot of changes happen to protect her offsprings. Just like that, during perimenopause as well, a lot of changes happens, and greater empathy is a part of that change. So, if puberty and pregnancy deals with motherhood, it is said researchers say perimenopause is associated with being a grandmother. So, a recent study conducted in tribal population shows that elderly mothers have a great role in preserving the community as such. When the males of the community go hunting every day, only there is only few times when they come back with something great. So to feed the family, women have to collect small berries and fruits from the nearby forest. So when mothers are busy nourishing their kids, taking care of their kids, it is actually the grandmothers who go to the forest, collect these berries, and take care of their kids and their grandkids. There is more me time available, and there is a lot of opportunity to for growth and development of a woman during this time. The interest, priorities, and attitudes shift. The overview she has about the whole world changes. She becomes fearless. And this is an opportunity to rewire the brain or to reinvent herself. A renaissance phase is going through. And there is a system update or some upgrade, if you can say that. So, what is important is the phase through which she passes during these menopause. So, just as a child psychological and physical development happens during puberty, menopause is also a stage when a lot of changes and development happen in a woman's body and mind. So, what she needs is time, patience, and care. This is why it is as important to study menopause just as we study pregnancy or puberty. It is unfortunate to say that there is not much study going on through this phase of womanhood. So let's study what is menopause. By definition, it is a natural and biological transition marking the end of a woman's reproductive life. If a woman has no menstruation for 12 consecutive months, a full year, she is said to have attained menopause. So, the age from which the menopause can be expected is between 45 and 55 years. Globally, the average is around 51. And in India, according to the Indian Menopausal Society, it is 46.2. So if menopause happens before the age of 45, it is termed as early menopause. If it happens before 40, it is premature menopause, and it is mostly due to pathological reasons like primary ovarian insufficiency. Induced menopause is when unnaturally menopause happens after surgical removal of uterus and along with ovary, or after the side effects of chemotherapy or any medications. Late onset menopause is when a woman experiences regular or irregular menstrual cycles even around her 60s. So, a few terms we should be aware around menopause is premenopause. It is obviously before menopause happens, before the 12 months of no menstruation has been completed. Then this premenopause can again be divided into two: early premenopause and late premenopause. So early menopause is when these symptoms start to arise, and menstruation is skipped for not more than 2 or 3 months. And late premenopause is when menstruation is skipped for more than 3 months, and there are lots of symptoms like hot flushes, insomnia, mood swings, cognitive changes, muscle loss, and everything about which we'll discuss in later slides. Then post-menopause is obviously after menopause, after the 12 years of no menstrual cycle has been completed. It is again going to be the for life. Postmenopausal is going to be for life, but it is again divided into early postmenopause and later. Early postmenopause is when some symptoms remain. So these periods are together called perimenopause. I mean, when all the symptoms of menopause exist, that stage is called perimenopause. It is around menopause. A few years before menopause and a few years after menopause. So this is the time when the body and mind of a woman goes through all the confusion, all the turmoil, all the chaos, and A lot of roller coaster of emotions and hormones are happening during this period. And this is the period when she seeks utmost support and patience. And also, the self awareness is important that all these symptoms that drive her crazy is not because she's actually going crazy, but because she's going through menopause. So, when does this start? Around 40 years of age. And the first and the most common symptom would be irregular menses. Menses can be shorter, longer, heavier, or lighter, and it can be skipped altogether for 2 or 3 months until finally you get a full long year of no menstruation. Then it can last for up to several months to a few years. On an average, you can say it is around 7 years. So, estrogen plays a key role. It is the most important hormone. You can say it is the most important feminine hormone. It has the role of nourishing the nurturer. Okay, it takes care of a woman just as a woman takes care of her family and those around her. Estrogen, though a feminine hormone, does not limit its action around feminine organs or female reproductive system. It has action almost on every part of the body. Let's see quickly what all are the areas of action. It regulates the menstrual cycle, of course, supports mood and cognitive function, controls body fat distribution, regulates cholesterol levels, promotes healthy metabolism, affects insulin insensitivity or affects insulin sensitivity, promotes cardiovascular health, helps regulate body temperature, then aids in bladder and urinary tract health, maintains vaginal lubrication and elasticity, influences libido, supports breast tissue development, maintains bone density, helps maintain joint and muscle health, improves skin elasticity and hair health, and support immune system functioning. So you can see how vast and widespread the action of estrogen is. So absence of this hormone or rapid decline of this hormone affects multiple areas in our body, resulting in clinical features related to vasomotor symptoms, psychological and cognitive changes, urogenital and sexual symptoms, somatic and musculoskeletal symptoms, and long-term health risks. So let's discuss all these symptoms in detail. Firstly, it would be the psychological symptoms. Those the symptoms faced by a lady can vary depending on her hereditary or genetic factors, depending on her lifestyle, and depending on her immune system and predeciding diseases she has. So, the quantity and quality or intensity of the symptoms can vary accordingly. So regarding the psychological symptoms, the primary one would be the mood swings. So in disproportionate anger, anger over trivial issues, then anxiety, irritability, palpitation, sensitivity, depression, reduced self-confidence, then cognitive problems like brain fog. She can't think about something for a long time. She can't concentrate on something as she used to do previously. Then attention span is reduced, slower processing. So slowness is in general, physical and cognitive. And does this make a lady completely useless or does this affect her productivity? No. For a short period of time, yes, it can. But also, again, this is subjective. These cognitive changes are, researchers prove that they are subjective, highly subjective. So there are no pathological changes happening, but subjectively she feels all these mental fatigue affecting her productivity. There is lack of motivation, again, due to the hormones like serotonin and dopamine, which is the reward hormone, And the happiness hormone, due to the decline in levels of these hormones, there is lack of motivation, lack of energy to do something. Again, she enters a room just to wonder why she has entered the room. She forgets sentences mid-sentence. She forgets and she misplaces her keys or her things. She doesn't know why she's weeping. Suddenly she starts weeping. Suddenly she feels angry, especially towards her family. So these are just a few symptoms to mention. There are a lot of other cognitive and psychological symptoms a woman can face during perimenopause. Then coming to the vasomotor symptoms affecting the blood vessels, it is primarily the hot flushes. There is hot flashes and hot flushes. So hot flash is something suddenly like a thunderbolt or lightning, a sudden upsurge of heat comes to the body, resulting in hot flushes. Hot flushes is sudden dilatation of the blood vessels around the chest, around the skin, around the face, especially the upper part of the body. And there can be also hot flushes felt on the palms and soles of the body, again depending on the individuality of the person. So these hot flushes last for maybe a few minutes, then it vanishes by itself, but it is very debilitating, especially when it is accompanied by palpitation and anxiety. Again, night sweats, spells of profuse sweating is very discomforting and disturbing the sleep, again increasing the cortisol or the stress hormone levels, and it goes as a cycle. The stress increases the discomfort altogether, uh, causing more distress and discomfort to the person. And it can be followed by chills. So everything comes spontaneously and suddenly. The estrogen hormone affects the brain in the hypothalamus, which is the thermostat or thermoregulatory function center of the body. So it becomes more sensitive to those slight temperature changes. So even when there is slight rise in temperature, the hypothalamus uh, um, presses a panic button and sends the heat wave through all of the body. And again, the estrogen affects the brainstem, affecting sleep, the amygdala affecting the emotional regulation of the body, and then the hippocampus affecting the memory center of the body. So it's not just the ovaries affected, the brain is affected, and the whole body is affected. Coming to the somatic or the other bodily symptoms during perimenopause, the primary and first symptom would be dryness in general. Dryness of the skin, dryness of the internal parts, dryness of the vagina, dryness of the mouth, and almost all the internal organs, that reduces the blood flow to particular organs and again causes atrophy and degeneration of the organs, layer by layer. And slowness in general. As I said, it is physical and psychological slowness. Then there would be changes in pain sensitivity. Tolerance to pain decreases extensively. So even slight pain is taken as a lot of pain or large pain. And it is not psychological by itself. It is pathological and physical symptom as well. Then sleep disturbances, especially due to the night sweats that happen 2 or 3 times a night, disturbing the sleep, again releasing cortisol or the stress hormone. Then there are weight fluctuations. Okay, estrogen was the hormone responsible for the distribution of extra fat all over the body. But decline in estrogen creates a confusion for the fat cells to where to be deposited. So the easiest part is the visceral area, the abdominal area. Also all the fats get deposited around that area. So there is especially a weight gain around the abdomen. Then Digestive issues, like there is general slowness leading to constipation, indigestion, bloating, heaviness. There can be loss of appetite or maybe increased food intake, maybe due to the psychological depression that is happening along with this. Then, coming to the musculoskeletal symptoms, the muscles, bones, and joints, three of them are affected. Micro-inflammation is happening in different parts of the body, and acids are deposited, like lactic acid, get deposited in these micro areas, causing corrosion, inflammation, pain, and discomfort. So there is muscle loss happening that is again related to calcium metabolism. Bone loss happens and joints become weak. Again, dryness happens in the joints, causing friction and pain for movements and in general body. So bone density loss begins, leading to osteopenia, osteoporosis, and osteoarthritis. That reduced collagen production leads to stiffer joints. Collagen is the protein that provides elasticity to different parts of our body. So there is, due to reduction in estrogen level, there is reduced collagen production, which creates stiffer joints, reduced flexibility of the joints, tightness in the joints, and also skin is affected, hair is affected. Then coming to urogenital symptoms, mainly happens due to the urogenital atrophy or loss of cells happening particularly to those areas. The first symptom would be urinary incontinence, losing control over your bladder or involuntary passage of urine. It can be stress incontinence or urge incontinence. Stress is which happens during sudden bouts of cough or sneezing, and urge incontinence is when you're okay, you're fine until you get the urge to pass urine or until you see the bathroom, and then you can't even reach the doorstep of the bathroom before the urine gets passed. Then there is pelvic organ prolapse. The muscles of that area, pelvic muscle, pelvic floor muscles gets weaker. These are the muscles which hold the organs inside the abdomen. So when they become weaker, there is a wearing down sensation of prolapse, as if heaviness in those parts. So there can be uterine prolapse, rectal prolapse, or urinary bladder prolapse. Then overreactive bladder leading to frequent urinary tract infections. Then sexual dysfunction, again due to dryness of the vaginal parts, causing painful intercourse and lack of libido and discomfort. Then coming to dermatological symptoms, dry skin, skin is dehydrated, there is itching, skin becomes sensitive, thinning of the skin due to loss of collagen and elastin, hyperpigmentation or melasma. Even in homeopathic books, there are medicines mentioning yellowish saddle around the cheeks. And it is melasma or hyperpigmentation happening during menopause, perimenopause. Then slower wound healing, increased sensitivity and irritation, adult acne or breakout flare-ups. Then there is hair thinning and hair loss, facial hair growth. So all these again contributes to the mental discomfort and loss of self-confidence during this period of perimenopause. They think their beauty is getting lost. They are becoming irrelevant and unattractive, again leading to the mental disturbances. Apart from all these symptoms, the prominent of which we have discussed now, there are long-term risk factors associated with perimenopause or menopause. One primary risk factor we have already discussed was the Alzheimer's disease. It is predominant in females just because they get perimenopause or menopause at an earlier time than the men. So again, there is calcium metabolism getting affected due to menopause. Calcium absorption from the intestine, which is again facilitated by estrogen, gets affected. There is less calcium absorbed from the food we intake, and then there is more excretion happening through the kidneys. So there is deficit of calcium in the blood, and this deficit is trying to be compensated by getting calcium absorbed from the bones. So bones become less denser. The condition is called osteopenia, and when this continues for a period of time, the bones become so brittle that they can easily fracture, and this condition is called osteoporosis. So there is increased fracture risk even without any severe fall or injury, especially happening to the hips, spine, and wrist areas. So there is muscle cramps and joint pain. Again, calcium is absorbed from the muscles, causing muscle loss, and the ligaments and tendons are also affected, causing joint pain. So cardiovascular disease risk also prevails. So this is like there is inflammation, there is a loss of elasticity of the blood vessels, which causes increased deposit of atherosclerotic plaques around the blood vessels, inside of the blood vessels, causing risk of atherosclerosis. There is narrowing of blood vessels, causing higher blood pressure. Then there is risk of diabetes mellitus type 2. There is risk of thyroid disorders, and there is risk of metabolic syndrome. Again, metabolic syndrome is a set of symptoms with hyperlipidemia or increased abdominal obesity, increased fasting blood sugar, increased blood pressure, and this is a condition which predisposes to cardiovascular accidents or stroke or myocardial infarction, diabetes. So all these risk factors are added to a lady who is facing menopause. Then diagnosis. The diagnosis usually happens with the clinical symptoms. There is no blood test that can prove you are going through menopause or perimenopause, or trying to predict at what time or what age you are going to get menopause. It is completely on clinical symptoms. So there are some supportive tests that can be conducted. It is just supportive, not confirmatory. So the levels of FSH, estradiol, LH, luteinizing hormone, anti-Mullerian hormone, inhibin B, TSH, and prolactin levels can be supportive of the stages of menopause. Then management. Do we need to manage menopause? Because we said it is a natural and biological process, but it doesn't actually need treatment, but it does require management, because this transition is the phase of a rewiring or reprocessing your internal system, psychological and physical system. So the phase through which you pass is important. How it gets rewired. So the main step towards managing perimenopause is lifestyle management. By lifestyle management, I would emphasize on two things: exercise and diet. A regular exercise is important. So it needs to have three components. One would be cardio, mixed cardio, just to burn the calories. And then it would be the stretching exercises to strengthen the muscles and balancing the muscle loss happening. Then there would be weightlifting exercises to strengthen the bones. So unless you do these exercises, the muscle loss and bone depletion can't be controlled. So whatever you eat, whatever medicines you take, you need to do proper and regular exercises on a daily basis under the guidance of a professional. Then Then comes the diet. Balanced and proper diet is important. That too under proper guidance, and we'll discuss that in our later slides. Then the next important thing would be adequate hydration, not less, not more. Hello, am I audible? Hello? Okay, thank you. You can see my screen, right?
Yes,
Thank you.
yes, yes.
Okay, thank you.
Now the screen is out of. Now it is out. Please reshare once again.
Okay.
It's okay. Lifestyle measures. Okay.
Yes. Okay. So again, sleep hygiene is important. You have night sweats happening at least 2 or 3 times a day. That can be very distressing. Again, this can happen to some women and not happen to other women. Insomnia without sleep disturbances can also be present. So one reason for sleep disturbance can be these night sweats. So sleep hygiene is important. Have your dinner at least 2 hours prior to your bedtime, at least 1 hour prior to bedtime. Switch off all the bright lights and switch off all the gadgets. And then practice pranayama or breathing exercises just before the bedtime. So cool the room to a favorable temperature. Then wear proper clothing. All these are contribute to the sleep hygiene. Then there is stress reduction practices. Again, like pranayama, yoga, or some hobbies can be started, like gardening or painting or music. Learning something new can always contribute to the happy hormones and the motivation hormones. Exposure to sunlight is yet another thing that is a source of vitamin D, essential for the absorption of calcium in the body. And then there is supportive relationships. Family and friends play a crucial role during this turmoil or chaotic phase of perimenopause. Coming to the food regulations, phytoestrogens can help. Phytoestrogens are plant sources of estrogen. They are soya products like soya bean or soya chunks or soya milk or tofu. Legumes and pulses can help, especially when they are sprouted. Then fruits like pomegranate, seeds like flax seeds, almonds, nuts can help. Then cruciferous vegetables like broccoli, cauliflower, cabbage, spinach leaves can help, and whole grains instead of the multi-purpose grain or maida. Then calcium sources like milk, curd, and paneer has to be added to the diet. Finger millet, ragi can help in calcium enhancement. Moringa leaves, amaranth, sesame or til. Then almonds and peanuts again, chickpeas. They are rich sources of calcium. Vitamin D again is essential for the calcium absorption, and primary source is sunlight, and the duration of sun exposure is also important, and the time gap at which you are getting exposed to the sun is also important. So ideal sun rays are the UVB rays, and the time you get the UVB rays is in between 10 a.m. and 3 p.m. So getting exposed to sun at least for 10 to 20 minutes during this time frame can help develop vitamin D in your body through sunlight. Then secondary source of vitamin D can be eggs, fatty fish like sardines, milk, and mushrooms. Then cholesterol controlling diets can be oats, brown rice, millets, olive oil, garlic, walnuts and almonds, and whole wheat. Then anti-inflammatory foods can be turmeric with pepper, both of them together. Then ginger, garlic, leafy vegetables, walnuts or flax seeds, amla or any other berries. Then foods that are that should be avoided are deep fried items like bhaji or pakoda, sweets and desserts, then bakery products, excess tea or coffee. Tea or coffee again you can consume, but maximum up to 4 p.m. Not after that, it can affect your sleep. Then excess rice at night can be avoided. Pickles or too spicy food can be avoided in large quantities. Again, spices are essential to enhance the digestion process as naturally it is reduced. So spices can be good, but not in larger quantities, and definitely not a large quantities of red chilies. Then, what is the medical management? If all these diets and regulation and exercise doesn't help, or they are not able to do it properly, then we need to have medical management. On allopathic aspect, there are hormone replacement therapy, testosterone gel for reduced sex drive, estrogen for vaginal dryness and discomfort. For those who can't take hormone replacement therapy, there are non-hormone medicines, and definitely cognitive behavioral therapy for psychological and cognitive issues. But again, our Padma Vibhushan Sri Dr. V.M. Hegde states that and a hormone replacement therapy is anti-nature. So what is a substitute for all these medical management? Definitely the first option would be homeopathy. And as uh, homeopathic physicians, we all know homeopathy is an individualized type of medicine. It's not that you have hot flushes and you take sepia or lactasis, and you have headache symptoms, you take latromor. It's not like that. The patient's symptoms are studied properly with all the modalities, aggravation, amelioration, peculiar symptoms, their constitution, their thermal regularities. Everything is studied together, evaluated, and then an individualized remedy is prescribed to every patient. Then, naming just a few medicines that are commonly prescribed for perimenopause in homeopathy. They are sepia, calcarea carb, pulsatilla, lycopodium, lachesis, natromor, graphitis, sulfur, phosphorus, and ignatia amara. Again, these are just a few medicines that can be recommended. Then, sepia officinalis is a medicine most commonly prescribed for perimenopause, especially for ladies who are around the age group 35 to 50 years. They have lean, tired looking constitution, pigmentation is high, hair fall is high, worn out and multitasking mothers with emotional dullness and indifference to family, indifference to their loved ones. Then great sadness and weeping disposition, irritability, wants to be alone. Then there is pelvic heaviness, bearing down sensation. They are comfortable sitting their legs crossed. Then better from exercise, dancing, and exertion is a peculiar symptom of sepia. Coming to calcarea carb, she's fat, flary, fat fair and flabby, woman of 40, then slow movements, slowness in general, but her mental movements are accurate and precise and fast. So physically she is slow, she doesn't want to be moved, but mentally she can do all the calculations very fast. Then easy weight gain, anxiety about health and future. She is always afraid her confusion is will be known to others and others are going to think she's crazy. Then longing for eggs and sweets. So it is not just craving, it's longing for eggs. Then she likes sweets. Then slow metabolism, tendency for hypothyroidism, that gets tired easily, gets breathless on climbing stairs. And Valsatla nigricans is a typical Indian wife or Indian lady in the Sophie serials coming on TV. She's gentle, emotional, family-dependent woman. Always wants the warmth of whoever is sitting near her or her loved ones. Then soft, rounded features, slow circulation, tendency to varicosities, VP wants support. So weeps for no reason, VP dispositions. For silly reasons, she starts weeping. Even she can't explain why she has started weeping. Then symptoms constantly change. She has mild, friendly temperament, yielding temperament, easily influenced, desire for open air, dislikes stuffy rooms, digestive upset after or digestion upset after oily or fatty foods. Then Lycopodium is a perfection-driven woman. She's an intellectual and perfection-driven woman, wants everything perfectly done, and gets cranky or irritated by those silly imperfections done by others. Then thin upper body, larger lower body, then hair fall is prominent, gas, acidity, or bloating is prominent, dominant at home but timid outside. Again, in her office, she is dominant to her subordinates but timid to her superiors. Then performance anxiety, right-sided ovarian or uterine complaints, worse from 4 to 8 p.m. especially. Then irritability, worse 4 to 8 p.m. is a peculiar symptom of lycopodium. Then irritability from hunger can also be noticed. Lachesis is often suited in perimenopause with strong emotional and vascular symptoms. She's slim, energetic, and expressive lady, prone to hypertension, then hot flashes, worse at night, talks a lot. Loquacity is a peculiar symptom of lachesis, and she has intense emotions. Jealousy, suspicion, and oversensitivity, cannot tolerate tight clothing around neck or waist. Then left-sided ovary or breast issues are prominent. Generally, left side issues are most common. Then wakes up aggravated. Aggravation from sleep because she does not get proper sleep. The cortisol hormone is increased. She wakes up aggravated. Then Natrum Moore, again, is a very sensitive and introverted woman, tall, slim, with dry skin, hair, and lips, has anemic tendency, reserved, suppressed emotions. History of grief or disappointment is prominent. Headaches and migraines, weight loss despite appetite. So ravenous hunger, eats well, but in spite of that, she has weight loss, craves salty food. Graphitis lady is slow, heavy, and indecisive disposition, overweight, soft skin, tendency to keloids, obesity with constipation, dry, rough skin, eczema, slow digestion, bloating, sadness from long-standing stress, and cold intolerance are the prominent symptoms of graphitis lady with menopause. Then Sulfur Lady is the most creative among the group. She's intelligent, imaginative, have many ideas, often enjoying philosophical and deep debates. Hot patient, lean, pot-bellied, then messy yet intelligent. Abdominal obesity, heat aggravated, burning of arms or soles. dislike bathing, creative but disorganized, skin allergies, itching. So she's famous to wear rags. Then phosphorus lady suited for affectionate and sensitive, empathetic women, tall, slender, delicate, with bright eyes, a very friendly constitution. Then anxiety and fear of being alone. So she always needs friends and needs people around. So she makes sure she makes them happy and comfortable to be around her. So excess worry for others, weakness after small exertion, bleeding tendencies are prominent, and thirsty for cold water. Ignatia Amara is an emotional woman, common for emotionally burdened women who bottle up grief. So they don't express their grief properly. They are easily and drastically affected by their emotional changes happening around them. So fine featured, nervous and tense, emotional shock, heartbreak, and grief. So during perimenopause, when a lady goes through an emotional shock, especially by loss of someone or a drastic change happening in their life, emotion ignatia can always be a solution. Then contrary moods, crying alternating with laughing, lump in the throat feeling, or there can be lump in your urinogenital area feeling sensation, then headache from suppressed emotions, she is easily offended. So there are a few follow-up parameters that can be checked on to assess whether a lady is getting benefited from the medication or not by assessing the frequency and severity of hot flushes, the sleep quality, mood stability, vaginal health and urinary symptoms, changes in general energy and well-being, the musculoskeletal pains, reduction in concomitant symptoms, and observation of the remedy action regarding aggravation, amelioration, or the stationary symptoms. Then, most important health test for women that can be recommended to be done regularly or on annual basis are CPC, complete blood count, thyroid function test, lipid profile, HbA1c, vitamin D and B12 levels, mammogram, liver function test, kidney function test, pap smear and HPV test, bone mineral density or test or DEXA scan. So again, winding up our session, perimenopause is a state of hormonal roller coaster happening in the body of a woman, and it is a stage of rewiring and reinventing herself, an opportunity for renaissance, and the smooth or the she has to be allowed to do this transition gracefully. And homeopathy has a major role to play in this transition and easing this transition. So, as homeopaths, I wish each and every one of you best of luck for all your endeavors. Thank you, IFPH.
Thank you, Dr. Dhanalakshmi, for coming over here and delivering such a beautiful session for us. Just like a gentle river flowing in a smooth atmosphere. Yes, that was such a beautiful session. And you have mentioned about everything about this menopause and why this happens and how we can differentiate it from each medicines accordingly. But your picture itself shows the expression of the patient, that even calcaria curve, graphite, sepia, phosphorus, electromore, ignitia, and all those photos itself shows you can how easily how to differentiate these medicines. That much of pain you have taken for this presentation. And anyway, congratulations. And usually
Thank you.
we get a lot of cases of patients who are coming over here into our clinic with a lot of symptoms, and they don't know why this happens. So sometimes their parents or their better half may not be able to differentiate why this lady is behaving like this. She was not like this in this before, but now she's entirely different person. But these are the things we need to educate our public and people, particularly not only to women, but all in the family. They need to have a better knowledge about the menopause. That's the reason why a lot of suspicion, lot of separation, all this are happening. Anyway, I mean, even though we have only a few minutes remaining, we can have a short time for discussion. Dr. Rambaresasa, you can say something here.
Thank you. Dr. Dhaneji, congratulations, Dr. Dhanalakshmi Madam. Very nice, excellent session. Very good describe the menopause and woman remedy, differential, sign and symptom, ignacia, netramule, lacatis, pulsatilla. Very good describe or important remedy. Lot of remedy describe the menopause condition, hormonal disbalance, vitamin D deficiency, so electrical disbalance, chemical disturbance, hormonal disturbance, and mechanical disturbance. So very, very thanks, Dr. Dhanalakshmi. Thank you, madam.
Now I am inviting Dr. Sridhara Kumsar to say a few words. Yes, sir. Sridhara Kumsar, please.
Yes,
Yes, sir.
you can hear. You cannot.
Yes, yes, sir.
Sorry.
I can hear you. We can hear you.
Yes, madam, it was Dr. Dhanalakshmi. It was a very excellent session, very good. But nowadays it is very common. The other system of treatment, other systems cannot do what we can do it, especially in menopausal age. So many problems. Not only women, men also suffer due to that, and the whole family will suffer. But we are having very good, excellent remedies. What you have mentioned, we all are using the same thing, and we are getting the benefit. Anyway, it is a good subject. All are getting different kinds of the conditions and different types of the patients. We are able to cure completely. With that, our medicines are very capable to do that. But the selection is only the problem that if you may daily study and when you may treat, definitely you can be an expert within this subject. Thank you very much. Come again for another session like this. Thank you very much. Wish you all the best. Have a nice time. In behalf, we may
Yes, sir. Yes, sir. You can say water thanks also, sir.
Yes, in behalf of we are having, it is going to within 1 or 2 months. It is going to be 2,000 days. So it is it is not so easy to conduct three sessions. First is in 7:30 to 8:30 in Hindi. Then now it is in English 8:30 to 9:30. Again Malayalam. It is not so easy. It is very difficult. Anyway, I congratulate the organizers and the other people who are supporting us. Thank you very much, and I thank each and everyone. Now at present about 27 people are there. Of course, it is without free costing anything. You can see into the YouTube also. So nowadays it is earlier it was up to more than 100 people were participating. It is number is comparatively low. Still that people are coming. Thank you each and everyone and organizers and the moderators also. I thank you especially the coordinator Dr. Nanesh and Manoj and so many other people who are interested in moderating this session. Thank you one and all the doctors, students, and the lovers. Thank you very much. Good night.
Thank you.
Thank
Thank you,
you.
Sridhar. Sridhar sir and thank you, Dr. Dhanalakshmi, our Mallan, and those who attend the session in this evening. And tomorrow we will have a session from Dr. Divya Radhakrishnan, and she will be talking about understanding materia medica and case taking through levels of experience. So with that, we come to the end of the day 1910. Thank you all. Good night. It's over to Mr. Shaliraj to moderate the Malayalam session.
Thank you, Doctor.